why this exact space. We particularly through my experiences in consulting, I have this realization that, on the one hand, you have payers where, in unnecessary ER visits alone with just commercially insured patients, there's like a loss of $30-some billion a year, just commercially insured every year, right? And just unnecessary ER visits, not unnecessary urgent care visits or unnecessary whatever other visits, unoptimized visits with out-of-network providers. So there's a lot more waste besides even just the $30 billion a year. So you have that on the one hand. And on the other hand, you have health systems that are competing for patients. And now, not only are they competing with each other, they're competing with One Medical and Roe and, all these other D2C healthcare brands, HIMSS, that are really going after, the outpatient revenue of health systems. And when you take a step back and you actually look at the numbers, right, you realize that health systems alone, right, not considering private practices and clinics and other sources of care, make about $500 billion of outpatient revenue every year. And when you look at an individual health system, you realize that outpatient revenue contributes to often over half of already pretty thin profit margins, right? So people generally think like it's all about the inpatient revenue, the surgeries and like all that, like really high value procedures, which is true. That stuff is really important, but that stuff is very expensive to deliver too. And so the profit margins often are not as big as you think with those kinds of procedures. So health systems really depend on this outpatient revenue, people just kind of coming in and walking clinics because the volume of it is so much greater. And so now you have all this external competition. So you have health systems that are not digital first, not consumer centric, that are now competing with these D2C digital first consumer centric brands. And this is an existential problem for these companies that really need to be able to compete in the sphere of being consumer first. Otherwise, they risk losing a huge percentage of their business and potentially just going bankrupt. And we're kind of starting to see that happen, where health systems that aren't taking the consumer really seriously and the consumer experience really seriously are suffering relative to those that are. So that realization is say, okay, well, there are some symptom checkers out there. There are some triage tools out there, but no one's really hitting the nail on the head in terms of really getting someone from the point of, I think I need care, to actually getting that care with transparency through the whole process, and getting the right care in the most convenient and affordable way possible. So that was a lot of the context and backdrop. And, this was 2 years ago that we started the company, a little over 2 years ago that I left my job and we started the company. And we've made a lot of progress since then in a relatively short amount of time for a healthcare SaaS company, I think. But it's always a bit longer than other companies. But that was those are some of the drivers, that the realizations through our work experiences that made us realize like there really is an untapped opportunity